So 3 months later, the patient walked in, and before I even had a chance to say good morning to him, he immediately said to me, "Doc, I feel like I've got my teeth back again." And that's always a very good sign. We sat him in the chair, we took some photographs, and let me show you what it looked like. So a picture of the upper arch, the implant crown in position, picture of the lower arch with the lower implant crown in position. I had a chat to the patient about brushing his tongue. Picture of the front side view of the mouth. His hygiene had improved substantially from when we originally had seen him. Picture of the left side view of his mouth, and a picture of the right hand side of his mouth. The first thing that we always look at is the color of the adjacent gingiva, and that looked beautiful. Boring pink is what I call this color, and it's the ultimate color that you want to have. Nice boring pink. Boring pink means no problems. And that's a wrap of this case. I think the most important lessons that one can take home in this particular case are that sometimes patients arrive with various symptoms, various desires. It's like a jigsaw puzzle, and if you do a careful evaluation and you pick up opportunities, like in this particular case that the patient had this lovely exostosis that we were able to harvest and then put into his sinus, this comes back and helps you see with the ISQ readings what high readings we were able to get even from a sinus lift. For more junior clinicians, this kind of work might seem like a lot of work, but I can assure you that I didn't get to this point overnight. This took me years to be able to get the confidence and the routine of many different cases to be able to get this kind of workflow. I think it is very important for clinicians to have good backup staff. I've been very fortunate to have 2 excellent assistants that helped me with these procedures. And so we were able to basically condense the work that needs to be done into a very short period of time. So I'm not doing two-handed dentistry, there's 6 hands helping me so that the work can flow very quickly. This is what patients enjoy. What traumatizes patients is when you sit them down and you have them in the chair for long periods of time. If you can do the work quickly and effectively, patients appreciate it, everybody's happy, you even get to have a cup of coffee afterwards. And finally, if there's any questions or something that you'd like me to explain, please don't hesitate to leave that in the comments below. We'll have a look at them and we'll address them in upcoming videos, and take care.